Hello, you're welcome to our program. Today we are discussing nursing process. Okay, so we'll start by defining nursing process as it is written here. I think it's visible enough. Okay, so the nursing process, we are saying this is a systematic problem solving approach used to identify, prevent, and treat actual or potential health problems and promote wellness. Okay, the other statement I will say, nursing process is a scientific step-by-step method of creating a holistic, individualized care for each patient. Now, there are components of uh, nursing process or the steps of nursing process. So these they go by the mnemonic ADPI. ADPIE. ADPI. A is for assessment, D is for diagnosis, P is for planning, I is for implementation, and E is for evaluation. ADPI. Okay, so the first step is assessment. Okay, so assessment, this is the first step in the nursing process. Okay, it involves critical thinking skills and also data collection about the client. Okay, so this data collection, it can either be, or it can be, I can say it can be subjective or objective data. Okay, so the second step is diagnosis. Diagnosis, we are talking about the nursing diagnosis and not the medical diagnosis. So the nursing diagnosis, we may say like this is a statement, okay, which talks about the patient's needs in relation to their condition. So the nursing diagnosis, there are three things that you need to put into consideration when you're writing a nursing diagnosis. Number one, it is the problem, the same problem that you've identified when you're assessing. Okay. Number two, you need to write the etiology or the probable cause of the problem that has been identified. Number three, you also write the characteristics or the signs and symptoms. Okay, so remember the characteristics or the signs and symptoms. For example, a patient verbalizing pain, headache. So say headache is a problem. Okay, so you can also include the etiology. You can also include the patient verbalizing, which is a sign, and symptom, which is a symptom. Headache is a symptom. Okay, so now after you've written your nursing diagnosis, you come to the planning. Planning, this is where now the goals and the outcomes and the actions are formulated in order to help the patient. Okay, so you say, how am I going to achieve my goals? Since I've formulated the goals, I need to lay on my actions. When you put the actions that will help impact the patient care. Then the other step is implementation. Implementation, now these are the actions which are taken by the nurse in order to achieve the goals that have been laid upon in the plan. After you've implemented, you've done the action, you need to evaluate. That's the final step or the last step in the nursing process. This is where now the reassessment is done to see if the patient is responding well to the actions that have been done, to the intervention that have been done in order to achieve the goals. So if the patient is responding well and good, you are doing a good work, you need to continue. So we decide whether to continue or we say, I've done the work, and we start reassessing and doing, finding other problems. If there's no good response, you also start reassessing and replanning in order to achieve your goals. Next time, we are going to discuss about nursing care plan, how to write a nursing care plan, the components of a nursing care plan. Until then,